poor circulation, memory loss, and even heart failure. These issues can start with something as often ignored as a dry mouth upon waking. Most people simply roll over, drink some water, and continue with their day. But what if that dryness has nothing to do with thirst? What if it's your body sending you a warning? It's been sending for months, maybe years, and nobody taught you how to read it. Here's what always makes me pause when I consider it. Chronic morning dry mouth affects nearly 1 in 3 adults over the age of 60, and in the overwhelming majority of cases, it has absolutely nothing to do with how much water you drink the night before. Nothing. Yet, this discussion is not taking place in most pharmacies, nor is it a discussion occurring at most yearly checkups. It is simply not being had. Please stay with me until the end, because the leading cause I will discuss today is likely found in your medicine cabinet or on your nightstand at this moment, and it could be causing much more harm than just drying out your mouth. We're talking about something with the potential to affect your kidneys, your heart, and your brain simultaneously. I'm Dr. Amelia Lawson, a physician with over 10 years of dedicated clinical experience, focused on the health of adults over 60. During that period, I've consulted with numerous individuals who presented with seemingly minor issues, only for us to reveal a significant underlying health problem that had been concealed by that single overlooked symptom. Morning dry mouth is exactly that kind of symptom, deceptively simple on the surface, potentially life-changing underneath. What I will now explain challenges a notion most of us have been subtly conditioned to believe: that aging brings discomfort, and a dry mouth is merely part of growing older. I want to be direct with you. That is not the complete truth. And after 10 years of watching patients suffer unnecessarily because this information never reached them, I'm not willing to stay quiet about it any longer. If you find this beneficial, please click the like button immediately. It helps this reach the people who genuinely need it. Let's discuss what truly occurs within your body on mornings when you awaken with the sensation that your mouth is filled with cotton. Your mouth depends on a continuous supply of saliva, and saliva is not simply water. It is a sophisticated biological fluid carrying enzymes, antimicrobial proteins, minerals, and protective compounds that defend your teeth, your gums, your throat, your digestion, and your immune system around the clock. When salivary glands start to slow or other bodily systems encounter difficulties, saliva output decreases, and when it falls significantly, your mouth dries out, especially overnight when you are not drinking, not speaking, and not doing anything to stimulate saliva flow naturally. After the age of 60, your body already produces roughly 30 to 40% less saliva than it did in your 40s. This reduction alone creates true vulnerability, but it turns genuinely hazardous when combined with the 7 factors I'm about to disclose, as none of these factors merely dry out your mouth. Every single one of them is pointing to something deeper happening inside your body. Here is what concerns me most as a clinician. Chronic dry mouth is associated with a 45% higher risk of systemic infection in adults over 60. Saliva serves as your mouth's primary immune defense. Remove it, and bacteria, fungi, and viruses gain a direct path into your bloodstream. Therefore, let's examine all 7, progressing from the least concerning to the one that troubles me most. And by the time we finish, you will know exactly what to watch for, what to say to your doctor, and what you can do differently starting tonight. Prior to starting, I wish to ask you a personal question. How long have you been waking up with a dry mouth? A few weeks? Several months? Years? Leave your answer in the comments below. I read each comment, and your response helps others viewing this understand they are not solitary. The 7th item on our list is the most frequent cause I encounter, and also the most overlooked: mouth breathing during sleep. Before you dismiss this point as obvious or innocuous, I need you to understand something crucial. Mouth breathing during sleep is almost never just a habit. Based on my clinical practice, it is almost always indicative of another underlying issue, and that difference is profoundly significant. When you breathe through your mouth at night, air moves directly across your tongue, your palate, and the back of your throat. This continuous airflow evaporates moisture at a speed your salivary glands cannot adequately match during sleep. The result is that sandpaper feeling when you wake up, cracked lips, a thick or coated tongue, sometimes a sore throat that has nothing to do with any illness. However, this is the aspect that troubles me considerably more than the dry mouth itself. Nighttime mouth breathing is often caused by nasal congestion, a deviated septum, nasal polyps, or sleep apnea. And sleep apnea specifically is not something to disregard. Research shows that untreated sleep apnea is linked to a 60% increased risk of stroke and a 40% increased risk of heart failure. If you awaken with a dry mouth and also snore, feel unrefreshed after a full night's rest, or if a loved one has observed you occasionally stop breathing during sleep, please do not dismiss this as merely how you sleep. Speak with your doctor about a sleep study. That one discussion could be more important than you realize. For individuals whose mouth breathing is unrelated to sleep apnea, the practical remedies are simple and impactful. A nasal strip worn across the bridge of your nose before bed can increase nasal airflow significantly, encouraging your body to breathe the way it was designed to. A humidifier in your bedroom set between 40 and 50% humidity reduces overnight moisture loss dramatically. Switching to a side sleeping position reduces the tendency to breathe through your mouth, and a small strip of surgical tape placed vertically over the lips before sleep, something sleep specialists have used for years, gently trains mouth breathers back toward nasal breathing. Many people notice a real difference within the first week. The sixth point is the error I observe most frequently, and it appears entirely reasonable until you grasp why it fails. Many individuals who awaken with a dry mouth presume the solution is straightforward: consume more water before sleep. So, they do exactly that. They finish a large glass right before they turn the light off, and they wake up just as dry as before. Occasionally, they feel even more exasperated because they followed all advice, and nothing improved. Here is why. Your body does not hydrate in real time. When you drink water, it takes between 30 minutes and 2 hours for that fluid to be absorbed, distributed to your tissues, and made available for functions like saliva production. Fluid ingested at 10 gauge p.m. provides minimal benefit for your mouth by 6 gauge a.m. the following day. The window has already closed. The true issue lies in what occurred or did not occur during the afternoon. Research found that adults over 60 who did not maintain adequate fluid intake between noon and 4 in the afternoon were 62% more likely to experience significant overnight dry mouth compared to those who stayed consistently hydrated throughout the day. 62%. That is not a small difference. And after 60, this becomes harder to manage naturally because the body's thirst mechanism becomes genuinely less reliable with age. One can be significantly dehydrated, yet experience no strong desire to drink. Many people also quietly reduce afternoon fluids to avoid nighttime bathroom trips, which is completely understandable, but it creates a hydration deficit that peaks precisely when you have no way to correct it. The remedy is not additional water at night, it is front-loading hydration earlier. Aim for 6 to 8 Oz with every meal and every afternoon snack. And here's a small but effective pro tip. Add a pinch of sea salt and a squeeze of lemon to your afternoon water. This supports electrolyte balance, helping your cells actually hold on to the fluid you consume rather than letting it pass straight through. The fifth point is something that surprises nearly everyone, as we seldom consider nutrition a direct cause of a daily oral issue. Your salivary glands are not passive structures. They are metabolically active tissues needing specific nutrients for proper cellular function. And two distinct deficiencies compromise salivary gland performance in adults over 60 more rapidly than almost anything else. The first is vitamin A. This nutrient is essential for maintaining the health and integrity of every mucous membrane in your body, including the lining of your mouth, your throat, your nasal passages, and your digestive tract. When vitamin A concentrations decrease, these membranes grow thinner, drier, and gradually less effective. Research found that adults over 60 with low vitamin A levels showed a 41% reduction in resting saliva production compared to those with adequate levels. That is not a subtle effect. That indicates your salivary glands are operating at a fraction of their full capacity. The second is the B vitamins, specifically B3, known as niacin, and B12. Niacin deficiency directly disrupts the nervous system signals that trigger saliva production in the first place. A lack of B12 results in the tongue becoming inflamed, unusually smooth, and continuously dry, a condition termed glossitis. Combined, they lead to a dry mouth that no amount of water can fully address, as the issue is cellular function, not merely hydration. After 60, B12 absorption drops significantly due to reduced stomach acid production, and research suggests up to 30% of older adults have inadequate B12 levels without any awareness of it whatsoever. For dietary sources, focus on sweet potatoes, dark leafy greens, and eggs for vitamin A, and lean meats, fish, and dairy for B12. For numerous adults over 60, supplementation may also be essential. Look for a B complex containing at least 1,000 micrograms of B12 in methylcobalamin form, the most bioavailable version available. And a useful tip, vitamin A is fat-soluble, meaning its absorption is far more effective when ingested with a small quantity of healthy fat. A drizzle of olive oil or a few slices of avocado with your meal makes a genuine difference. The fourth item is the combination I consider most critical in my practice. And if this situation pertains to you, I urge you to listen carefully, not with apprehension, but with the realization that early knowledge is paramount. If you awaken with a dry mouth and also rise to urinate more than once nightly, that combination serves as a clinical red flag I never overlook. Combined, these two symptoms represent some of the initial indicators of unregulated blood sugar and occasionally undiagnosed type 2 diabetes. Here is the mechanism. When blood sugar levels rise beyond a specific limit, the kidneys labor excessively to filter and eliminate surplus glucose. To do that, they pull water from the body's tissues. That internal fluid loss dehydrates you from the inside out, and one of the first places you feel it is in your mouth overnight when there is nothing you can do to compensate. The timeline is what renders this so crucial. Research found that morning dry mouth was reported by 63% of adults newly diagnosed with type 2 diabetes, and that most of them had been experiencing that symptom for over a year before their diagnosis. More than a year of their body indicating an issue each morning. I recall a patient, a retired woman in her early 70s, sharp and active, who visited for an unrelated matter. She mentioned the dry mouth almost as an afterthought as she was leaving. I asked a few targeted questions. Was she waking at night to use the bathroom? Yes, regularly. Unusual afternoon fatigue? Yes, I ordered a fasting blood glucose panel that same week. Her result came back at 148 milligallon per deciliter. She had type 2 diabetes and had been living with it unknowingly for well over a year. Within 4 months of targeted dietary changes, daily movement, and supplementation with berberine and magnesium glycinate, her fasting glucose had normalized. She told me at her follow-up, "I finally feel like my body is working with me again." That is what catching something early looks like. It's not a crisis, it's an opportunity. The third point is a condition impacting roughly 4 million Americans. Yet, the typical patient waits almost 3 years from the onset of symptoms until a diagnosis is finally obtained. 3 years. That is not a medical oversight. It is a deficit in the discussions occurring within examination rooms. The condition is called Sjogren's syndrome. It is an autoimmune disorder in which the immune system mistakenly targets the body's own moisture-producing glands, primarily the salivary glands and the tear glands. The result is persistent dry mouth, chronic dry eyes, difficulty swallowing, and in more advanced cases, systemic involvement including joint pain, fatigue, and effects on the kidneys and lungs. Women over 60 are disproportionately affected, representing nearly 90% of diagnosed cases. So, Why is it so challenging to identify promptly? Because each symptom is addressed in isolation. The dry mouth is often dismissed as a sign of aging or dehydration. The dry eyes are typically attributed to screen time or seasonal allergies. The joint pain is often classified as arthritis. No single doctor connects the dots, and the underlying autoimmune process continues unchecked the entire time. The key diagnostic indicator I want you to remember is this. If your dry mouth is consistently accompanied by eyes that feel dry, gritty, or burning, and particularly if you are a woman over 60, please ask your doctor specifically about Sjogren's syndrome by name. A blood test measuring two specific antibodies, anti-SSA and anti-SSB, can identify the condition in most cases. You have the right to request this test. Do not wait for someone to offer it. There is no cure for Sjogren's, but there are effective treatments that manage symptoms and slow progression significantly. And for instant relief while pursuing answers, sugar-free gum with xylitol is among the most readily available tools without a prescription. It stimulates saliva production and simultaneously inhibits the decay-causing bacteria that dry mouth encourages. The second point is something most individuals would never associate with a dry mouth. Yet the connection is authentic, it is documented, and every adult over 60 deserves to know about it. Your salivary glands do not operate independently. They are governed by the autonomic nervous system, specifically the parasympathetic branch, which oversees the body's rest, recovery, and digestive functions. When this system is compromised, salivary activity diminishes, the mouth dries out. What renders this notable is that autonomic nervous system dysfunction is an identified early characteristic of Parkinson's disease and Lewy body dementia, and research has shown that these autonomic changes can appear 4 to 6 years before the classical motor symptoms that typically lead to a diagnosis. I recall a patient, a retired man in his late 70s, who was methodical and quietly observant. He had reported a persistent dry mouth over several appointments. We had worked through the obvious explanations, medications, sleep position, hydration. Nothing fully resolved it. Then, during one appointment, his wife mentioned, almost in passing, that he had stopped recognizing the smell of his morning coffee. He had noticed it too, but said nothing, assuming it was unrelated. It was not unrelated. I referred him to a neurologist. Imaging confirmed early Parkinson's disease. He was shaken, but because we found it early, he was able to begin neuroprotective therapy and build a care plan well before significant motor symptoms developed. 3 years later, his quality of life remains truly good. He told me at a recent visit, "I almost mentioned the dry mouth. I thought it was too small to bring up." Nothing is too small to bring up. Your body is always communicating. Our job, yours and mine together, is to learn how to listen. The primary cause I most often observe in my practice is also the one most frequently overlooked, inadequately conveyed, and in my view, most warrants a direct, candid discussion. Over 500 commonly prescribed medications list dry mouth as a side effect. Over 500. For adults over 60 who take an average of 5 or more prescriptions daily, the cumulative impact on salivary function and on brain health can be profound. The drug classes most frequently responsible include antihistamines, antidepressants, blood pressure medications, bladder medications, antipsychotics, and certain pain medications, including muscle relaxants. What renders this truly hazardous is a concept known as anticholinergic burden, the combined neurological impact of numerous medications that obstruct acetylcholine, a vital neurotransmitter. High anticholinergic burden has been linked in multiple large studies to accelerated cognitive decline and significantly elevated dementia risk. The dry mouth is not the ultimate outcome. It is the visible signal of something happening much deeper. I recall a patient, a retired man in his mid-70s, who described waking each morning with a sensation of having swallowed chalk. He had been on the same medication combination for years. Not one prescribing physician had ever collectively reviewed his complete medication list. A medication reconciliation identified 2 drugs with overlapping anticholinergic effects, both of which had safer alternatives. We made 2 substitutions. Within weeks, he noticed the difference. Within 2 months, he told me, "I wake up feeling like a normal person again, and my thinking feels sharper than it has in years. That was not a mere coincidence. Here is your plan of action beginning tonight. Stop any over-the-counter sleep aid containing diphenhydramine. Melatonin at 0.5 to 1 mg is a far gentler alternative. Run a humidifier at 40 to 50% humidity. Front-load your hydration through the afternoon. Brush with a fluoride toothpaste formulated for dry mouth before bed, and try a nasal strip tonight. Then this week, write down every medication you take and bring that list to your doctor. Ask directly, do any of these suppress saliva production, and is there an alternative? You are not broken. Your information was merely incomplete, and starting right now, that changes. If this video assisted you, please hit the like button. Subscribe to this channel for additional genuine health solutions tailored specifically for adults over 60, and share this with someone you cherish, a friend, a family member, a spouse. You may just give them the piece of information that changes everything. I also want to hear from you. Which of these 7 causes surprised you most? Which one made you think, that might be me? Share your answer in the comments below. I truly want to know your story. Remember, aging does not remove your body's capacity to heal. It simply reminds you to care for it the right way. Take care of yourself.